Welcome to Thrive with Pride from Age Options, an online space for LGBT plus older adults and those who care for them. This is a recording of a live event held on Zoom. As always, we had a great Q&A which was not recorded. We invite you to attend next month's event. This month, we welcomed Brita Moran, the Community Engagement and Benefits Access Specialist at Age Options. Brita works with our Benefits Enrollment Center, which helps connect older adults to benefits that boost their overall budget, allowing them to access food, medication, and more. As we begin a new year, we invited Brita to share more about these cost-saving benefits that many people may not realize they're eligible for. Please see the video description below for a PDF of the slides presented in this recording and more. After you watch this video, please fill out a very short survey to help us improve our online programming. It is anonymous and will take less than 5 minutes. The link to the survey is also in the video description below. Welcome everyone to our January 2022 Thrive with Pride plenary. Today's topic is your 2022 benefit update. I'm so excited to welcome Brita Moran today. Brita is the Community Engagement and Benefits Access Specialist at Age Options. In that role, she oversees the Benefit Enrollment Center, the Benefit Access Team, and our SNAP Outreach grants. Brita is a graduate of St. Mary's College and Loyola University Chicago School of Social Work, where she received her BSW and MSW. Her areas of specialization are in social work include older adults, leadership and development, philanthropy, and mental health. When not working, Brita teaches Irish dance classes for children ages 3 to 13 and participates in community volunteer events whenever possible. Brita, welcome and thank you so much for joining today.
Thank you so much, Jason, for that very generous introduction. Good morning, everyone. Again, my name is Brita. My pronouns are she, her. I've worked here at Age Options since May 2020, so right in the smack dab of a lot of the lockdown situation due to COVID. But I have really enjoyed this new role here at Age Options. I'm really excited to share some information with you all about senior benefits that you may or a loved one of yours may be eligible for. As Jason mentioned, we'll take questions at the end of the presentation, but please utilize the chat box throughout the presentation so then we can keep track of what we can catch up on. And also, although I do have quite a robust amount of knowledge about these public benefits, I do want to remind you that I may not have the answers to some of your questions today, but I will be happy to provide you with some information after the presentation with, I can always edit my slides to improve some of the content for resources of your own. So without further ado, we'll get started. So my role is working with the Benefits Enrollment Center. So you might be asking, what is the Benefits Enrollment Center? And what the Benefits Enrollment Center is, it's made possible by funding through the National Council on Aging, which is located in Washington, D.C. They set a lot of the precedent for different senior benefits and things like that, but they provide us with the funding to make all things happen and spread education awareness as well as benefit enrollment, as it says in the title, for different public benefits that are available to seniors. You're seeing my screen, correct?
Brita, we are, yes. Oh, no, I'm sorry. I don't think we are seeing your screen. There you go.
Are you seeing this one now? I'm so sorry. Oh my goodness. All right. So our program goal here at the Benefit Enrollment Center is to increase the financial stability of older adults and persons with disabilities through enrollment in public benefit programs. And that really does mirror the mission of the National Council on Aging as well, where they work to improve the lives of million older adults, especially those that are struggling. So coupled with those two missions, we have a goal to increase access and education to public benefits for our constituents. So we focus on several different core benefits in the Benefits Enrollment Center for for the application portion. So we work a lot with the and please don't look at this and think that I'm expecting you to know the definitions, because that's what our presentation's for. I'll break down each of these core benefits here today. But the Medicare Part D extra help or low income subsidy, the Medicare savings programs, Medicaid, the Supplemental Nutrition Assistance Program, known as SNAP or previously known as the LINK program, the benefit access application, and new to age options recently is the Affordable Connectivity Program, as well as an increased effort and attention spent towards the Aid to the Aged, Blind, and Disabled Cash Assistance Program. So we will get going on defining each benefit. So the first one that we'll touch on is the Medicare Part D extra help and low income subsidy. So the extra help pays and assists Medicare beneficiaries pay the premium for their prescription. So Part D of Medicare is prescription drugs. When eligible and approved for the low income subsidy or extra help, you can save an average of $5,000 a year. And that's an estimate from Social Security Administration. The Social Security Administration issues that benefit. So when you are approved for extra help, that is what their estimated cost savings come to annually per recipient. And also people who receive Medicaid or a Medicare savings program or are receiving supplemental security income, you'll be automatically enrolled into extra help. With the Medicare savings programs, there's 4 different Medicare savings programs, but essentially this benefit allows for clients to have their premium assistance for Part A and Part B. So you can see here that there's 4 different Medicare savings programs that fall under the application that we submit, and there would be and the varying premiums that are covered by each program are listed here about which part is covered by which program. So we do have a chart of benefits, which is kind of the key to benefit enrollment in some essence of the word, where some of these programs have income limits or asset limits, which means that if you see more of a certain income, or if you're working, you may have different, not different, but your eligibility may shift because of your income or your assets. But it doesn't completely disqualify you from some of these benefits, which is why our Benefit Enrollment Center exists, to do that screening call with you to find what benefits are most suitable for you. For Medicaid, the coverage for Medicaid includes inpatient and outpatient care and services. Medicaid costs depend on income and the individual state's payment coverage for services. So state to state, the program can be different, or the coverage can be a little different, but we tend to see that out-of-pocket costs do exist for Medicaid, but they tend to be very, very low. And what's different about Medicaid from Medicare is that there's no special enrollment period. So if you're eligible for Medicaid, you can apply at any time for Medicaid. Our next benefit that we work a lot with is the Supplemental Nutrition and Assistance Program, the SNAP program. There is an income cap for the SNAP program, which is for a household of 1 is $2,127, and for a household of 2, $2,873 per month. So new to this year, there's a new application for smartphones that was launched, I believe in late November or early December, where beneficiaries of SNAP can now manage their benefits on their mobile app. So there's been a great push for that. And we will also be providing, we're also working on creating some content for consumers based on with their SNAP enrollment to understand how to use that application and things like that. But you can also use your link card at several big box and local chain grocery stores, as well as online. So the SNAP program is becoming more and more available to the consumer market, and your opportunities for purchasing groceries is increasing with that accessibility. The one thing about SNAP that I always remind our clients of is that the SNAP dollars that you receive each month can only go towards Whole Foods. And that is not the grocery chain Whole Foods, but that's towards whole foods such as produce, meats, cheeses, milk, bread, things like that. It wouldn't be paper products or cleaning supplies or pre-made meals at grocery stores. It would be whole produce that you would buy off the shelves. And one of our more popular applications that we do enrollment for here at Age Options is the Benefit Access application. This program is run through the state of Illinois' Department on Aging, as well as the Social Security Administration. They work together to approve the license plate sticker discounts and the ride-free bus passes. Applicants must be adults older than 18 living with a disability or older than 65 years old. The license plate sticker discount can provide a client with a discount from $151 for their yearly sticker registration down to $24. So it's a very big jump in your savings there. And although it's a yearly cost, it does have, long-term impacts. And we see a lot of clients working with the benefit access applications. Typically, an application is just a background screen on your income and what your monthly rent or mortgage payment is. And the Department on Aging and Social Security will verify if you fall under the bracket of eligibility there. And then you're typically your application outcome will be determined within 2 days. So you'll work with someone here at Age Options from start to finish. And we typically see about a week of needing to be in contact. So it's a pretty easy process. And we do a lot of these applications, and we have a working relationship with the State Department on Aging, that if there are issues with an application, we do call them directly to resolve those issues. So getting into the new programs that are here in our Benefit Enrollment Center is the Affordable Connectivity Program. And that's why I have an asterisk next to it, that we actually submitted our first application last week for a client. So we're really excited to see how the outcome of that is and how that benefit impacts our clients. But this program ensures that households can afford the broadband internet that they need for work, school, healthcare, and other connections that they require the internet for. This discount is up to $30 per household for an internet service to eligible households and clients. This was established in December of last year, and it was the result of an emergency broadband benefit that was installed during the COVID-19 pandemic. And seeing the increased number of households requiring this discount, they decided to make this, or they meaning the government, decided to make this benefit permanent, and providing a $30 discount to eligible households. So then programs like this can access more people. And our last program that we work with, and that's also new to Age Options, is the Aid to the Aged, Blind, and Disabled Cash Assistance, known as the AABD. So this program provides cash allowances for low-income adults that are blind, disabled, or over the age of 65. Typically, if you're eligible for AABD, you are eligible as well for SNAP because their income limits and caps mimic each other. And what's really great about the SNAP application and the AABD cash assistance application is that they are the same, that all you have to do is when you're filling out your information, we just click the boxes that we're screening and applying for, and it would be no extra application. It would just be a checkbox on the application, which is really convenient for purposes of enrollment and also for tracking your application and putting in your information. The current cash allowance for AABD is $794 a month, but the good news is that I'm working with our advocacy group here at Age Options as well as in the community to hopefully increase that over the course of the next couple of months to meet what the current federal poverty line is, because that is that cash allowance right now is significantly lower. And Age Options is also continuing to spread the word about the aid to the age blind and disabled cash assistance to make sure that we reach more constituents. So as just a recap from the conversation and the breakdown of each application, I created this, pie chart to show each of you what the breakdown really is with our applications. So we see a huge amount, 80% of our applications are the benefit access applications. Those are typically the most well-known because typically we see when clients turn 65, they call our office and say, I'm ready for my senior benefits, and we send them on their way. But we also see, again, another chunk being the SNAP applications and the MSP extra help as well as Medicaid. We see less frequent in the application department, but that doesn't mean that they're any less important to us. We always advocate for clients to seek out those services, but sometimes we have clients call and say, this is what I want, and that's all. So but we do screen for all the eligibility across the board with our client intake calls. And so this is a breakdown of what we did last year. So last year we did a total of 173 applications, and 80% of those were the benefit access applications. So here I do have a client story that I'd like to share that kind of ties in what our program really is all about. Please excuse me, I will be reading from one of our volunteers. She wrote a really detailed outline of a client that she worked with last year. This was a 65-year-old client that called our Benefits Enrollment Center in February of 2021, so just almost a year ago. He was needing assistance because even though he was told he was eligible for the Medicare Savings Program QMB, he would not have to pay for his Medicare Part B. This money was still being taken out of his Social Security check. He had called and also went to the Department of Human Services and the Social Security Administration offices a number of times in the last year and was still not receiving this benefit. The client was only receiving $1,309 a month in Social Security benefits. That was his income. And his rent was $925, leaving him with only $240 in total rent to last the month for his prescriptions, his food, utilities, and other expenses. Our volunteer, Denise, took his case and applied him for SNAP, and he is now receiving $223 a month for SNAP benefits. While Denise, our volunteer, was persistent and proactive, she communicated with the Social Security Administration and Department of Human Services to resolve this case. She made many three-way calls with the client, Social Security, and the Department of Human Services. Denise followed up and faxed the paperwork that stated he was eligible for this benefit. And finally, an intake worker from the Social Security Administration agreed to refile and follow up with a different department. The staff person said it might take a while, and 3 weeks later, they received a call that he was approved and he received an additional a reimbursement check of $2,000, which was the amount that he was owed for his premiums while he was eligible for this benefit. The client said that this money will allow him to move to be closer to his family, and now that he can make a security deposit on an apartment and pay moving expenses and more. He was ecstatic and grateful, and he said that Denise at Age Options were persistent and caring when other staff agencies had given up on him. So we see a lot of clients seek a lot of success with their applications. Typically, we see clients that have already received some benefits but are looking for more. So what our screening and intake calls really do is breaking down what they're eligible for in terms of what's already available, and we do our best to get them enrolled in anything and everything that they could be eligible for. So you might be asking, talking about enrolling and calling for an intake. So the way that we operate here at the Benefits Enrollment Center is we are a call center. So a lot of our communications take place over phone. So we would ask you to call this phone number 708-383-0258 at the extension for the Benefits Enrollment Center, which is 393. Or you could email us at benefits@ageoptions.org to set up an enrollment appointment. All the applications require an intake screening, which we complete over the phone. We do ask some information related to income and, your household, how many people are there, what expenses you might be responsible for. And we intake all of that to upload onto your applications. And then we kind of become your point of contact to those applications. We don't have any special access to your application, meaning the Department of Human Services and then the Illinois Department on Aging typically are the powers that determine eligibility and also determine the outcome of the applications. But we work very closely with them to troubleshoot any issues that might be coming up with applications as well. Our Benefits Enrollment Center is open from Monday to Friday from 8:30 to 4:30 p.m. Due to the pandemic and the remote working right now, we do have a voicemail callback system. So typically our voicemail is turned over every 24. Well, we intake our calls, but we provide ourselves with a 24-hour window to give you a call back to do an intake screen. But that is all of our contact information. And Kate also, the people that come to our events are really passionate about giving back to the community, and some of them are really interested in volunteer work as well. So lucky for everyone here on this call, we are looking for volunteers in our department. We have two different opportunities, one being an enrollment officer, which means I say in office, but we're currently remote, which would mean that you would do intake screens with our staff, with clients over the phone, and help and submit their applications online. Of course, there would be a training and all of that guaranteed, but we're looking for enrollment officers as well as benefits ambassadors, which would mean out in the community, distributing some of our materials to spread the word about our programs and the applications that are waiting to be applied for some of our clients out in the community that might not be aware of what's out there for them. So I would ask that if you're interested in any of the volunteer opportunities to reach out to me directly, and my information is here on the screen, my direct email as well as my direct phone line. And that is my presentation. Again, I put our kind of business card here if any of you are interested in working with us. But other than that, that is our presentation today.
Thanks again to Brita for that wonderful presentation. Don't forget to see the video description below for a copy of the slides. Call us at Age Options 708-383-0258 and ask for Benefits Enrollment Center to see if you might be eligible for benefits, or visit the link in the video description below. Please join us for our next monthly event on February 22nd, 2022, Healthy Living for Your Brain and Body, an educational presentation from the Alzheimer's Association. Login information is at our website and below in the video description. Thanks again for watching, and please don't forget to fill out the quick survey below.